Hello YouTube! Welcome to my fourth video in my ulnar shortening osteotomy surgery series. Said it faster that time. My name is Hallie, once again. Today I'm just going to talk about pre-op. It's going to be a short little just recap video. So my pre-op appointment was yesterday. I went in just to kind of clarify some questions, double check with my surgeon, make sure everything was good, have him look at my wrist. And it went well. I told him that I had more pain, and he looked at it, and my ulnar head is more prominent than it was before. So there is a actual physical anatomical reason why I'm in more pain. So that's always nice to hear that your pain is validated. We went over the surgery with me and the potential complications. In one of my last videos, I told you that he was going to be doing a stepwise cut, and that is not true. He actually told me that he will be doing a slope cut, is what it's called. So instead of doing the step system, it's just a slope, and you just like pull up the slope. And this is actually just as effective as the stepwise cut, but it increases the surface area that the two sides of the bones are touching, which means hopefully a less chance of a non-union. And then also there are less screws in this system since it's just one longer cut instead of like I guess it's just one cut, but instead of kind of two separate cuts, you only need to have one screw through the cut site. So it ends up, I think it's 5 screws instead of the 8 that the stepwise is. So, I mean, that doesn't really matter. He's going to do whatever cut he wants to do. But it's just nice to know, nice to hear, nice to be aware. We talked about the chance that the hardware won't feel nice in my arm. But again, he reassured me that he does everything in his power to get it as tight and flat on the bone as possible. So hopefully that won't be an issue. With COVID, no one is allowed in the hospital with me at all, in the surgical building at all, besides patients, which is fine, but it's slightly frustrating for me because I live an hour and a half from Spokane, from the surgical center. So, and I can't leave the surgical center by myself. So one of my parents are going to go with me. They're going to drive me up there. Then they just have to drop me off. He told me that the surgery is usually 3 to 4 hours, 4 hours from check-in till drop-off, or check-in till check out. So then my parent will just have to be in the car, go explore Spokane, whatever, for 4 hours and then pick me up, which is just slightly frustrating to me. But I understand we're in a pandemic and life is hard. So yeah, that is what it is. What else? I learned that the type of splint I'll be in after surgery, the surgical cast, is called a sugar tong splint, which is cool. It just means that it goes like, it wraps around your arm and around the elbow and then back up, and then they'll wrap it, and yeah. He also did mention that he is comfortable with just putting me in a short arm cast after I get the surgical cast off. However, a long arm cast can be used as like if they're worried about healing and if they're worried about the patient doing something that might hurt healing. And so I am probably going to ask him to be in a long arm cast because it scares me that I have the ability to mess up the healing of my arm after surgery. You know, if I do something out of reflex to reach forward or do something like that, then I don't want to do that. I want it all to heal well and perfect and all of that. So, but that will be in a few weeks. I asked him about a bone stimulator, and he said that isn't necessary at this step, that later on down the road, if the bone isn't healing, that is when he will give me a script for a bone stimulator and use that. He said to continue taking all medications even before surgery. So don't stop any of my multivitamins, anything else. Like take everything the day before surgery with just enough water. And then he also clarified the whole ibuprofen, acetaminophen thing, that aspirin takes 2 weeks to get out of your system, whereas Advil and ibuprofen only takes 48 hours. So I could have continued to alternate the Advil and the acetaminophen until today, being Tuesday, 48 hours before my surgery. But since I was already only taking the acetaminophen, I figured I might as well just do it for the day and a half that he said I could go back to the Advil. So, yeah, he also told me not to wear my brace for at least the day before, if not 2 days before surgery. So I'm going to try to not wear it tomorrow and Thursday, and we'll see how that goes. And that's just so the skin can be hydrated and supple and happy for before surgery when they're going to cut it. Yeah, I think that's the gist of it. So just kind of a little update with pre-op. So everything went well. It was all good news. I mean, no really good news or bad news, just more information. Yeah. So I had a COVID test on Monday after my pre-op, or yesterday, I guess. And then this week, he said it needs to be somewhere kind of between isolation and a quarantine. Like, I can't see anybody and nobody can come near me, but it needs to be more than like chill. Like, I need to be very cognizant of who I'm around, don't do anything unless I really have to, things like that. So this week we're just kind of hanging at home, getting everything situated so that I can do absolutely nothing next week. And yeah, so that was pre-op. Everything went well. Surgery is Friday, and I will post a video for that as soon as I can after surgery. So bye, have a good week.